So recently, of course, there's been the whole COVID-19 thing, and there have been a lot of discussions on what countries have dealt with it the best, and so on. With a lot of these, it's kind of hard to be sure until after it's over, but for now, we should judge the responses anyway, since the responses are obviously most important as the pandemic is still going on. In America, there's been quite a lot of memes going on, but in some cases, I would almost say that Japan, who has often been considered to have one of the greatest healthcare systems in the world, has actually done worse in some aspects compared to America, and arguably not that much better in relation to how much better it should be considering their healthcare system. So, to start, let's provide the general perspective of what exactly has been going on in Japan during this whole pandemic thing. For whatever reason, despite being right next to China, Japan has stayed relatively low in cases pretty much the entire time, and only very recently even hit 50,000 cases nationwide, which is not really that many for a country of 120 million, and even that was mostly recently, and more than half the cases so far have been within the past few months, meaning that up until recently it was even less than that. Now, I want to be sort of more skeptical in terms of determining what exactly can cause a country to have more or less cases, as often we can't really be entirely sure until after the fact, and even then I think it would be reasonable to say that more factors can potentially affect this sort of thing than most subjects. For example, not only do the explicit responses to the virus affect how it pans out, but also pretty much everything in existence that ever happens within the country can affect how it spreads. For example, in some countries people touch each other more than in other countries. In other places people have certain genes that can make them more susceptible. The culture of mask wearing can be different, and the mediums by which people interact can be different, such as in some places people communicate in person more and with the internet less. So basically, effectively, almost literally everything that happens in a country can affect the ability of a virus to make its way through it. Some people have speculated that Japan's public etiquette and cleanliness culture have contributed to its lower number, or perhaps the accumulation of various genes in the population have. I would say that the former of these is likely to have contributed to that, but I'm not sure to what extent that really matters considering the virus is supposedly airborne. I'm not a virologist or a biologist, so my knowledge on this is not extensive by any means. Again, we cannot really be sure until things are over, but at this time, at the very least, we can conclude that the government's reaction to the disease is in fact not the reason that it is lower, and that these decisions on their own could also allude to the fact that the number is actually much greater than what is said. This is not to say that they are lying about the stats, no, more like the amount of cases allowed to be expressed are limited due to a number of obtuse reasons. So let's first explain the basics of how we know the number of infected people in the first place. In order for someone to be considered a case, a doctor needs to have determined this and reported it, and to be given reason to report this, the patient most likely will need to receive a positive result from a test. Of course, this also requires the patient to have initially considered actually going in for a test, which can be affected by the culture of a particular area, but that isn't something that the government or medical department really has any direct control over. So mainly, it seems like the most evident focus when considering this should be the medical department's decisions, and there are quite a few reasons we've been given for why the handling of the testing by the medical department and government has not been adequate. In an article from February of this year, it is stated that patients must meet two of the following criteria to be able to be eligible for a COVID test. First, that they were either in one of the infected areas of China recently or were in contact with someone who was, and second, if they have a high fever and pneumonia-like symptoms that require hospitalization. Some patients report being denied a test after answering they had not been in China, such as a man who had been in Taiwan and had currently had a temperature of 39 degrees Celsius. He was denied a test as the center told him that visitors to Taiwan are not eligible, but eventually he was able to get one after he went to other clinics. Others have been given similar reasons for not being allowed a test. Another article from April states that, at the time, Japan had been conducting 7,800 tests per day compared to the US's amount of 150,000. Factoring in that the US has about 3 times as many people as Japan, this means that America has around 6 times the per capita tests as Japan, and the American embassy in Japan has even called for American citizens in Japan to return to America due to fear of inability to deal with the situation for fear of it getting worse. It's pretty crazy to see something in America, of all places, criticizing the response of Japan, considering Japan has much better healthcare and that America hasn't really handled it that well either. Partially, this is because the US is advised by the CDC, a National Advisor of American Public Health, despite being independent. Japan has a similar agency, but it is comparatively underfunded and not independent. And even Abe has said that perhaps the lack of an effective agency has damaged Japan's response to the disease, and claimed that he quote-unquote might make one back in February. And I believe some candidates for his replacement are also claiming that they may want to make such an agency. Ultimately, in a lot of cases, it seems like the decision to test someone is left behind a lot of red tape and provisions for whatever reason. I won't claim I understand enough about the Japanese medical system or how it factors into the government to actually say whether this is intentional or not, but it is probably both a bit intentional and also not. Regardless, the doctor could could arbitrarily decide to not test someone, and even if they did decide they should be tested, the center that doctors called to get a test done often would not answer, or the patient would not be called in to actually do the test even after they were approved. Another issue seems to be the lack of resources due to being overwhelmed, at least from what they tell us, as clinics will often only take 8 tests a day due to apparently being overwhelmed, citing that exercising caution to prevent spread of disease among the clinic as being part of the reason, and also that many clinics simply won't take any tests. Furthermore, it seems at some points that the system is deliberately made obtuse in order to reduce the amount of people who get tested. Those who are chosen for a potential test are often forced through a number of other tests in order to eliminate the possibility that the virus is the reason for their symptoms. As someone not versed in the medical field, I may be wrong on this, but wouldn't just testing them for the virus tell you if they have it or not in the first place? Testing for other things just seems like avoiding the question so they can write it off as something else, like deliberately trying to reduce the cases in this manner. Another factor in this is that patients who are found to have pneumonia-like symptoms are often told to stay home under the assumption that they have the virus, in which case they are not being reported as having the virus. But seriously, the level of apparent incompetence and seeming attempts to cover things up here seems ridiculous. Like, if even America, of all places, is managing to test far more people per capita, and I believe there if you go in for anything you get tested anyway, then I don't understand how Japan, of all places, could have such trouble getting only 8 tests per clinic a day. Like, at that point, it just has to be deliberate or bad management. There's no way it's actually for a good or justifiable reason. And it's even worse considering that there are many people who are turned away in other cases. One doctor noted that a high-risk elderly patient was turned away from the office despite having many pre-existing conditions due to the clinic not having the resources to take care of them. The doctor responded by going to his house personally to test him. However, who's to say that many who were turned away for a similar reason were not responded to in this way, and their condition worsened without treatment, or even they eventually died? For all we know, there could be many people who were diagnosed with something else or were not diagnosed with anything and have died recently, and we will never know that they were actually infected with the virus. This is why everything is so unreliable on paper when you have such low testing. And I just want to put into perspective how unreliable the testing is in this case. So, as of now, Japan has about 8,700 tests per 1 million people, compared to the US's numbers of 209,000. Yes, 209,000, meaning that the United States tests 24 times as many people per capita than Japan. Let's also look at some other countries other than America that have a better testing rate than Japan. Iraq, Turkey, Brazil, Cuba, Iran, Ukraine, Nepal, Rwanda, India, Costa Rica, Bolivia, Namibia, Ghana, Mauritania, and Mexico. Remember, Japan is considered a developed country with one of the best medical systems in the world, and it's falling behind countries like India, Bolivia, and Iraq in terms of this. This is not acceptable. This is a massive failure of the Japanese government to properly protect their people. So while this is clearly a failure in many ways, let's also look into how they have responded to this overall situation in other ways, as well as to accusations of their failure. So both America and Japan gave out money to everyone in the country in response to the virus, and they both gave about the same amount of money, with Japan giving 100,000 yen, or about $940, and America gave out $1,200. There are some weird complications to this here and there that make these programs sort of different from each other, but overall it doesn't make a huge difference other than that in Japan you need an address for it, and in America you don't need that, only a bank account, meaning that homeless people with bank accounts would not be helped by this in Japan, but Americans in the same situation would be. I think it's hard to say if one option was really better or worse. The thing is that they both seem a bit lackluster, so Japan having a similar response in compensation as America, but still worse testing, is not really a good look. But I think for America, it isn't necessarily a surprise considering the current administration, but I feel as if we should expect a country like Japan to settle for much better than about as good as America. Well, mind, I'm talking about good in relation to specifically this, but I would still say that America's response is overall worse. The second countrywide program that the Japanese government dedicated itself to was the sending of 2 cloth masks to what I believe is essentially every address in the country, but of course they missed some, probably. This is nice as obviously right now there is a shortage of masks. Often they're hard to find and they cost a lot anyway. Also, that cloth masks can be washed and reused as well. The problem is the mask is incredibly small and uncomfortable, to the point that it will barely cover your nose and mouth at the same time depending on how big your face is, I guess. They have colloquially been called Abe no mask, or Abe's masks, due to the association with the Prime Minister, which he did actually wear these masks for a while at public meetings, but he has since recently stopped wearing them in public, which is kind of funny, I guess. So, of course, the government has also said some things about the situation and how people have criticized them. Largely, the response to the criticism is sort of going along with the idea that the reported numbers being low means that they did a good job. They've even said that, despite the growing cases, the death rate is relatively low, so that makes it not such a big deal. While it's true that likely far more people died as a result of the virus than we know anyway, obviously, it's also absurd to imply as if the only bad thing that happens when people get the virus is that they can die. Like, people can also obtain chronic illnesses even after they're treated. They're basically useless while they have it, and the ability for clinics to appropriately deal with the virus and other conditions becomes much more difficult if they're overwhelmed, which we already discussed the consequences of this earlier. So it's a pretty irresponsible way for the government to look at this, in my opinion. It's just kind of admitting that they are at least in some way suppressing tests on purpose to save face, as it seems like anyone in the medical field would probably not say things such as, "Oh, it's okay because not many people died," since they actually know what they're talking about due to working in the field, unlike government officials. So finally, let's factor in my personal experiences to sort of provide some more context to this. While other things I've talked about here mostly haven't directly affected me, I just want to give an image as far as how it played out for normal everyday people in Japan who did not suspect they had the virus and did not or do not have it. So about February or March of this year, I started noticing more people wearing masks on the street than normal, but this was before the whole cultural reaction to the virus took place anyway, and it wasn't until some months later that I began seeing about half or more people on the street wearing them. It was around April that many businesses started closing, and as far as I know, this was entirely a voluntary decision either from social pressure or from realization that they would not get many customers anyway. Either way, for about 2 or 3 months, almost all businesses near my apartment were closed entirely except for the grocery area at the mall. For whatever reason, the country and businesses decided to eventually reopen basically everything. And the infuriating thing about it is that despite the cases going up quite a bit recently, as in more than the total amount in the first wave, the government's response has been basically nothing. Not only did the government not actually tell businesses to close or anything on their own, but they also essentially forced them to reopen and not close again while the virus got worse than it ever was while everything was closed. On my prefecture's site, it states that despite the fact that the majority of cases recently were contracted by people in their 20s and 30s within bars and similar establishments, that its advisory for this was to tell everyone to only go to these places for 2 hours at most and to wear a mask while there. I'm not sure about you, but while social gatherings are sort of a fun, arguably necessary part of human life, I would really question someone who suggests that we continue to engage in social gatherings that are unnecessary to our physical health as a priority over avoiding something that could affect your physical health for the rest of your life. Not to mention that the Japanese government hasn't really done a whole lot in response to this and even told people to travel the country during all of this, then didn't even tell them to stop once the second wave of the virus hit. The evident reason here is probably because they quote-unquote had to, or at least the government has not put in the appropriate provisions to make it possible for things to reasonably stay closed during all this while not destroying the economy. Or, well, look, I'm not going to claim as if I know what the best answer during all of this is, or that I know how to make the resolution compatible with how most countries currently do capitalism. All I know is that Korea did some stuff that was better, and maybe some other countries did, but I don't really know. It seems like some really ridiculous, stressful decision making, so I don't want to backseat them to a certain degree. But what I think I can say is that you should definitely not tell your population to travel around the country when there still isn't even any clear insight for the virus in terms of a vaccine. And you definitely also shouldn't refuse to try to tell people to stop even after the virus hits a second wave and gains far more cases than were gained in the first wave. Also, as a note, I'll say I went to the doctor and then a municipal medical center the other day, and they did not even test me or even ask me if perhaps I thought the reason I felt sick was because of the virus. And I also think some of the employees there were not wearing masks from what I remember. For all I know, I think a reasonable conclusion to make out of all of this is that there are many people currently suffering that we don't know of, and that the failings of the Japanese government here will likely end in many deaths that could have been avoided. And it's likely that we'll never get any of this to be attributed to them. It'll all go over everyone's heads because it was never really tracked in the first place. And then the Japanese government will probably go back to complaining and make up some stuff about how people not having enough kids somehow didn't put enough carbon dioxide into the air to help prevent spread of the virus, and it actually wasn't their fault at all that people died when they could have avoided it. There will probably be no accountability for it, and Japan will continue to decline economically while doing nothing about all of its meme problems that will most likely be exacerbated by all of this. But perhaps I shouldn't be that pessimistic, I guess.